Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Hello, listeners. Today we are going to talk about seborrheic dermatitis. Seborrheic dermatitis is a very common skin condition that affects the face, the scalp, and sometimes the chest. On the scalp, it's commonly known as dandruff. Dandruff and seborrheic dermatitis are the same thing. I'd also like to mention that seborrheic dermatitis we call in dermatology shorthand, or the nickname is sebderm. So when we say sebderm, dandruff, seborrheic dermatitis, it's all the same thing. So I want to talk about the condition, what it looks like, what causes it, and most importantly, how to treat it. First, let's talk about what seborrheic dermatitis looks like. And let's start with the scalp, which is the most common area. In the scalp, sebderm shows up as flakes, often itchy scalp, and often oily hair. It is possible to have each of these three symptoms separately or two out of the three, but they often all appear together. The most common sign of seborrheic dermatitis is flaky scalp. And as soon as people see flakes, they think that their scalp is dry and they immediately decrease their washing and add more conditioner. And this backfires pretty spectacularly because those things will make the problem worse. What is causing the problem is usually a yeast overgrowth that causes inflammation that shows up as flaking and itching. So when people decrease the washing and increase the conditioner and the oil, the problem actually gets worse. The solution is typically to wash more frequently and use less or no conditioner on the top of the scalp. There are certain shampoos with active ingredients that can help reduce the yeast overgrowth, thereby reducing the flaking and the itching, and I'm going to review the brand names and their generic ingredients. The most popular dandruff shampoo is Head & Shoulders. Head & Shoulders has parathione zinc in it as its active ingredient, and it absolutely works well. Another shampoo that I like a lot that has the same ingredient is Jupiter, which is a much smaller brand. It's sulfate-free, it's safe for color-treated hair, it smells really nice, and we carry this in our office. It is also available online, but Head & Shoulders also works great and is literally available everywhere. There are two other shampoos that are really helpful over the counter. One is Selsun Blue or Denorex. Those are two brand names, and they have selenium sulfide in them. And then the last but not least is Nizoral shampoo, which has ketoconazole in it. Any of these shampoos are really helpful to reduce sebderm. I recommend having at least two of the three active ingredients in the shampoo rotation. And I usually tell people you can rotate your regular shampoo in also, meaning Monday you use one shampoo, Tuesday you use a different shampoo, Wednesday you use a different shampoo, and then you start the rotation again. I do know that washing every day is not possible for many people, but the more you can wash, the better this condition will be. My other piece of advice is not to put heavy conditioner, which tends to be pretty oily, on the top of the scalp and just to use it on the ends of the hair. If shampooing more and rotating shampoos is not enough, there are prescription steroid solutions or foams for the scalp that are available from a dermatologist. Also worth mentioning that this condition is usually worse in the cold weather or the winter, and so some people really only have this certain seasons of the year. Now I'd like to discuss seborrheic dermatitis on the face. Sebderm on the face appears as flaky skin and is often red, but it is not usually itchy. It is very common in the eyebrow area, the ears, and the corners of the nose. It is pretty easily treated with topical antifungals such as over-the-counter Lotrimin cream, otherwise generically known as clotrimazole, or prescription ketoconazole cream. There's other varieties of these. The azoles usually work well for this. These creams work best if they're used twice a day to the affected areas, but when it's really bad or flaring up, I will often recommend hydrocortisone on top of the antifungal. And so the hydrocortisone cream can be over-the-counter, 1% or 0.5%, or a prescription, 2.5% from the dermatologist. And I usually recommend only using the cortisone for 2 weeks or so until it calms down and then to stop it, because cortisone can thin the skin and cause trouble if you use it on an ongoing basis. This plan of these creams almost always works. But if it doesn't, it's best to discuss this with your dermatologist because there are other creams and lotions to try, such as sodium sulfacetamide, otherwise known as Claron lotion, or Elidel or Protopic creams and ointments. It also may be that some of the new psoriasis creams, which are getting approved for eczema, also may work for seborrheic dermatitis, but these are issues to be discussed with your dermatologist. These are prescriptions. The vast majority of people will do well with the over-the-counter stuff and the usual recommendations. I'd also like to mention that Derm can affect the chest, and it usually appears as red flaky skin in the middle, probably more common in men than women. And when that happens, I recommend using the shampoos in the shower as a body wash in that area and also the same creams like we treat the face. And it typically is under control or goes away. I'd like to make a special mention of the ears because they are commonly affected by Derm. And while I usually treat my patients and get them under control with the usual creams, I like to remind people that the medications that I'm recommending are for the external ear only and can only go so far inside as you can fit with your finger. And if they're having itching and inflammation truly inside the ear, they need to see an ear, nose, and throat doctor or an ENT to get eardrop prescriptions. That my medications are not meant to go all the way in. So, in summary, seborrheic dermatitis, otherwise known as Derm, otherwise known as dandruff, affects the scalp, the face, and the chest, and is much more common in cold weather. Washing the scalp more can help. Rotating shampoos can help. Using dandruff shampoos are really useful, such as Head & Shoulders, Jupiter, Selsun Blue, or Nizoral. Avoiding oily products on the top of the scalp is helpful. And on the face, we often use either over-the-counter Lotrimin or clotrimazole cream and hydrocortisone temporarily. Same for the chest. And if you're not getting better, best to seek care with a board-certified dermatologist. I hope that was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.